Good afternoon, and thank you for joining us today. I'm just going to give one more minute or so to allow people to log on for today's webinar, and then we will get started. All right, well, welcome. My name is Ashley Mangum, and I prefer she and her pronouns, and I currently serve as the project manager for Kids Mental Health Pierce County, and we are so happy that you have chosen to spend time with us today at our first webinar of the new year, where we will be talking about transitioning to hybrid and in-person learning to provide resources for families and educators. We have two great presenters today, Dr. Chris Ladish and Tovah Fairshot, and really excited for the materials today. And so if this is your first webinar, I just want to introduce you to Kids Mental Health Pierce County. Kids Mental Health Pierce County is a coalition of people and agencies here in Pierce County that have joined together to address the growing behavioral health needs amongst school-age children and youth here in Pierce County. Pierce County, like many other counties across the state, is working really hard to meet the growing behavioral health needs of both children and adults. And Kids Mental Health Pierce County has served as that coalition here in Pierce County to address those priority actions and help advocate for children and families here in Pierce County. One of the things that we've been doing since the onset of the pandemic is hosting these monthly webinars. And actually the topic for today actually came from a past participant who asked for resources and support around this very topic. So while we're here to provide education and resources about transitioning to hybrid and in-person learning, another one of our goals for today is to provide a community forum of support. Get to know each other, utilize that chat box, that Q&A box. If you can access the chat box, introduce yourself. Also, if you have any strategies and ideas that you want to share, please do so. We will be having questions and answers at the end of both the presentations. So if you have any questions, please utilize that Q&A box that should be on your toolbar, and we'll do our best to answer all the questions that come through there. Also, if there's any questions that we can't utilize or get to before the end of today's training, we will do our best to follow up and answer your questions. Again, this training is being recorded. All of our webinars can be found on our website, which is kidsmentalhealthpiercecounty.org, and we'll also upload any training materials that are discussed today as well. So with that introduction, I want to introduce our first speaker today. I have the privilege and honor of introducing Dr. Chris Ladish. Dr. Chris Ladish is the Chief Clinical Officer of Pediatric Behavioral Health and Behavioral Medicine at Marybridge Children's Hospital and Healthcare Network. Dr. Ladish is a licensed clinical psychologist and pediatric neuropsychologist and joined Multicare in 1996. Dr. Ladish's areas of expertise include pediatric psychology and neuropsychology, brain injury, autism, neurodevelopment disorders, and gender-affirming healthcare. Dr. Ladish also serves on the steering committee of Kids Mental Health Pierce County Collaborative and Multicare Workplace Violence Prevention Leadership Group. She is passionate about improving health equity and access for all children in need of behavioral health care and supporting our teams to provide care to children under difficult circumstances. Prior to joining Multicare, Dr. Ladish obtained her doctorate from Washington State University and completed internships and fellowships at the University of Washington and Stanford Schools of Medicine. Dr. Ladish resides in Renton, Washington, and her wife and their two teenage children. Dr. Ladish enjoys traveling, biking, creating adventures with her family. Dr. Ladish also recently published an article titled Managing Returning to School Jitters During the Pandemic, which I will also share in the chat box. So at this time, I will turn it over to Dr. Ladish, who will be talking about strategies and tools to help manage anxiety as kids and youth transition back to school.
Thanks, Ashley. I am going to hopefully transition over and you can give me the okay if I get these things showing. You should in a moment have the screen up there. You let me know.
Yes, I see the screen and now I see you. You're good to go.
Okay. Thank you, everybody, and thank you for allowing me to just give sort of a 5-minute chat with you before Tovah gets to present her phenomenal material. And this is really just going to hit some highlights, and you'll get into a lot of fantastic content rather. So I have had questions put to me. I know a lot of parents, and also certainly at my household, we're talking about the whole concept of going back to school and the mixture of things that that brings in terms of a mixture of excitement and anxiety related to the thoughts of going back to school, especially in-person learning during a pandemic. When we talk about going back to school, I want to set a little bit of context about why we're having these conversations now and why we've even gotten to this point at this point in time. An article recently came out in the Journal of the American Medical Association, or JAMA, citing some of the recent CDC evidence that has been published related to school studies that are now happening, looking at kids who have either returned to in-school learning or who have been participating in in-school learning throughout the vast majority of the pandemic. Some of the school districts that are discussed are in Mississippi, North Carolina, rural Wisconsin. There are also studies that are reported that are international, as well as underscoring the fact that many of our private schools have remained in session throughout the pandemic. And what they're finding is that for the individuals who are, or the districts, I should say, that are following precautions, they're seeing that the precautions really are working. And those precautions are the things that we've been encouraged to do all along: masking, social distancing, and hand washing. I know that we can all recite those frequently now. As well, we're really looking at some of the districts that are using improved air ventilation systems. Some are putting up special plexiglass screens. There's lots of new and innovative things that have been learned by the school districts that have been attending school. And the results are showing that there is not any increased transmission in the community related to kids who are attending school. So with that in mind, the CDC has started to publish recommendations for a safe return to school, and a lot of the districts are having more conversations about this. Of course, as we all know, we have different incidence rates within not only states, but counties. And so we're still looking at our local governments about when and how we're going to go back to school. But the conversation has started. And for those of you like myself that sort of have a little bit of hesitation in thinking about all of that, I think it's helpful to start by remembering that we're much further along now than we were 11 months ago when all the kids were first sent home from school. Additionally, within the past week, the Office of the Superintendent of Public Instruction has partnered with Kaiser, and they're starting to put out recommendations for teacher-related vaccinations. So a lot more information is coming, and it's putting us in a much better and successful place to be able to consider this return to school. But let's talk about more specifically how we address when there are anxieties and worries there. The first thing that I would encourage you as parents is to really kind of sit and take inventory and to separate our adult fears from children's worries. And that is to say that while we all may be having some hesitation and anxiety about going back to school, what's in our mind as adults may not be the same thing that is in the mind of children. What we're hearing is that for most adults, the fear is really around COVID and the fear of increased transmission rates. When you ask children what their thoughts are about going to school, or are they having any fear or anxiety or worry about going back, they're talking about a range of things, from separation fears to the social pressures to having to get back up and get dressed and leave the comforts of home. So it's a multitude of things, and it's encouraged to take some pause before we launch into those conversations and really meet kids where they're at. I also recommend that we kind of set the tone. You know, I think a matter-of-fact approach is really encouraged here. We want to first, of course, listen and ask the right questions, and then really kind of think about, you know, how we can approach our kids in terms of their preparation and most setting them up for success. I think taking actions to reassure them and create stability, like practicing without pressure. What I mean by that is, can you visit the school grounds? Can you visit the playground? Can you put on masks with your kids and just walk around the area and then come back home without having to actually have that first start of school? That can do a lot to help kids feel like they're starting to get some comfort with the return. If your kids have fears around going back to school with COVID, of course, we want to remind them about the things they can control in terms of the masking, hand washing, and safe distancing. Additionally, remember and keep in mind, we've started school and gone back to school year after year after year. So relying on familiar routines, the things that kids are used to around return to school, can we pick out that getting back to school outfit, getting our school supplies ready, clearing out backpacks and having things ready, talking about bedtime and what time we're getting up. All of those things help kids start feeling a little bit more secure about what is to come, even though it's going to be different than it's been in the past. And then let's talk a little bit about kids who have potentially some more significant worries, who have been challenged with learning disabilities or mental health challenges while they've been out during the pandemic. A few highlights here that I'd like to underscore. First would be dig into your toolkits. You know your kids well, you know what their concerns are and what their challenges are. Now's the time to start brushing off strategies, really talking about mindfulness-based relaxation skills, taking a break, just really remembering kids what's in their toolkit as they prepare to go back to school. I also recommend focusing on the child's strengths. It's hard for us to even imagine how much we've been through, but 11 months ago, we were all adjusting to not being able to go back to school, and our kids have survived and weathered that storm. And I think it's helpful to remind kids that that was a rough transition, but we've made it through, and we'll make it through this transition again by going through it together. It's also helpful to take a one day at a time focus, to remain open and flexible, to remember that no one needs to be perfect in this. There really is no perfect in this. Sometimes just getting there and getting back to school is constituting the success. And so I really encourage, a sort of moment to moment to moment approach, not thinking about the remainder of the year or taking too much of it on at one point in time, but really just thinking in terms of small moments, getting through them, and then each new moment creates a new fresh start and an opportunity to get through. But what if it doesn't go well? What if our kids get anxious? What if they get afraid? What if they feel like they're, going to have a breakdown of sorts and they just are not feeling safe or comfortable? What do we do then? That's where I think it's important to have a support plan in place. And what I mean by that is simply for you, your child, and their safe person at school, be it their teacher, their counselor, the school principal, to all be on the same page about what are those first 2 or 3 steps that your child is going to take if they're in a circumstance where things don't feel like they're going well. Just knowing what those 2 or 3 steps are can really help bring down everyone's anxiety. And the reason for that is because it takes what's going to feel like an unpredictable situation and it makes it predictable. Because no matter what the circumstance, your child is able to say, I've got mom or dad's number in my backpack. I know that I'm going to reach out to my teacher. She'll take me to the school nurse. I'll sit for a few minutes, et cetera, et cetera. The more we have a few steps in place like that, the better our kids will do and the more in control they will feel. So just a few tips. I think Tovah is going to go into this at far greater length, and certainly I'll remain available for the end of our presentations today for any questions. Thanks, Ashley.
Thank you, Dr. Ladish.
Oh.
And Dr. Ladish will be here at the end of Tovah's presentation for any questions and answers. So don't hesitate to use that questions and answers box that is on your chat, as well as any of your own recommendations and ideas and strategies in that chat box. So thank you again, Dr. Ladish. So I have to say, when this topic was recommended, I automatically thought of Tovah. Tovah's been an amazing community partner with Kids Mental Health Pierce County. She's participated on at least 2 of our past webinars. And so if you haven't been able to view those, I would highly recommend you check those out on the Kids Mental Health Pierce County website, but I have the honor and privilege of introducing Tovah Fairshot today. And Tovah is an education consultant with an emphasis on building an efficient and results-driven system that meets schools where they are. Tovah strategically implements customized solutions for schools and districts. Tovah believes in building capacity academically, emotionally, behaviorally, and socially within a school system so all students thrive. She develops a purposeful partnership in support of improved outcomes. Tovah has partnered with numerous schools and districts to develop supports and resources for students that identify within the LGBTQIA+ community in order to make schools safe, welcoming, and inclusive of all. Thank you again, Tovah, so much for being here today, and I will turn it over to you for your presentation.
Awesome, thank you, Ashley. I feel like you should present me like in all of my PDs. It sounded so fancy.
That would be easy for me to do.
All right, I'm going to go ahead and pull up my PowerPoint, and I just want to give a disclaimer before going into the presentation is that my dogs have been extra rambunctious today. This is my third presentation, and they have said hello in the other two presentations I have been a part of today. So I just wanted to put that out there. If you hear any dogs, I apologize. So like Ashley said, my name is Tovah Fairshot. I use she, her pronouns, and I am an education consultant across Washington State. So I work in about 8 school districts total right now, ranging from ECAP. I'm in ECAP programs in both Lake Stevens as well as Enumclaw, all the way up through high school programs, really across the state. And with that, I know there's a lot of anxiety right now for us as adults and as educators, as parents, as school counselors, as teachers, to start talking about what does this hybrid learning look like and what is this transition going to be. I know for myself personally, the school districts that I'm working with in Eastern Washington are already bringing in their secondary students for hybrid learning. And so although Western Washington is a little bit behind in terms of students coming back into the building from where Eastern Washington is, this is conversation going on right now. And a lot of school districts are moving towards this model. So we know that this year, starting March 16th of 2020, so last year already, has felt like an anxiety hot mess in terms of education, right? In terms of how we're supporting our students. What does that look like in the classroom? What does that look like at home? What does that look like if I'm working from home as well? And we know that you as a caregiver, right, you as an important person in a child's life, whether that be your own child, a child in foster care. I know we have a couple of court-appointed advocates here today, a therapist, a counselor, right? You all play a very substantial role in supporting our students and supporting our children cope through, encouraging a positive back-to-school transition and figuring out how to help reduce anxieties. And we know that there's been a lot of information and a lot of misinformation and a lot of different forms of communication this year. I guess I should have told you all that another disclaimer is I'm a big memes person. That's like what brings joy to my day. So I try to put in some memes for all of my presentations. If not for you, then for me anyway. But we know that homeschooling, right, and what school looks like right now has been different than what it's ever looked like before. And what virtual learning and remote learning looks like for classroom teachers has been very different this year. It's different for parents as well, right? For parents that are trying to work full-time as well as support their child, especially younger children going through the schooling process. And just as a reminder, right, with all of you, all we want for ourselves is to make sure that we are providing ourselves that abundant grace. And so making sure that you are taking time and being patient with yourself while you are working through the challenges, the collective trauma that we are all facing through this pandemic. So for those of you that are familiar with Maslow's hierarchy, it's a theory through the education system that really looks at where do we need to be supporting our students and our children. And when we start at that foundation level, it's those physiological needs. This has looked very different this year because typically when we talk about physiological needs of our children, we're talking about, do they have food, right? Do they have shelter? And now those physiological needs have really shifted to, do our children have electricity? What does Wi-Fi look like, right? What types of computer devices are there? And of course, this has brought up, just as always in the education system, the equity issues that we are facing, right? So from there, it goes back up to safety, right? When a student has their physiological needs met, then safety is the next priority, right? And of course, in terms of this cyber world that we are all living in right now, it has to do with that digital citizenship, right? That digital footprint that our older students are leaving, firewalls, filters, and then of course, love and belonging, right? And so nowadays, in terms of love and belonging, we're thinking about social media, right? TikTok, where our youth, our adolescents, especially that middle school to high school range, are thinking of people loving them based on how many TikTokers are following them, right? Which goes deeper into their self-esteem, right? Where they need to receive that feedback. And nowadays, because of, our kiddos are carrying a computer in their hand, that feedback is feeling very immediate. They need that immediate gratification. And then when we get to the self-actualization, when we're talking about that in terms of the current state of affairs, we're talking about that intrinsic motivation. So where are students getting that intrinsic motivator from? What is their internal saying to them, right? And so this goes back to, are students engaged in the virtual world, right? Are in the virtual classroom? Do they have their cameras on? Are they utilizing the chat box, right? Are they turning in assignments? And as many of you know out there that are educators, we have seen intrinsic motivation go down significantly this year. That sense of belonging that students typically have in the classroom has been a real struggle to generate back into the virtual world. So now we are in this very unique situation where we are starting to combine this hybrid learning, right? So learning at home, doing that asynchronous work in addition to being in the classroom. And anxieties are going to come with that, right? Our students are going to have anxieties. A really common term that we use and that psychs use is, what you resist persists. Right? So that means that we want to be having these open and honest conversations with our students, with our kiddos, right? Young kids all the way up through high school. Avoiding the conversation often just leads to our students having more feelings of anxiety. And so it's actually more beneficial for our youth to hear from us and to acknowledge it is scary, right? We are living through something that we have never lived through before. So be honest, and it is absolutely okay to show your own vulnerability, right? We want to be honest and realistic with our youth. Talk about what they are excited for. When they are starting to go back into the classroom, what does excite them, right? What are they nervous about? And be honest with that. And then what are some things that will be changing when they go back into the classroom? And what are some things that will not change, right? They will still have their friends. Who are their friends, right? We start with something like that, and then dive a little bit deeper into the things that we know are going to be changing for them. So in terms of what this looks like, and I wanted to make sure I broke it down for younger grades, right? Younger ages, as well as the upper ages. But when you're talking about what does this look like, discuss the differences, right? Class size is going to be different. We know that. Class size is going to be smaller. We know right now some school districts, the students that they have had as their for a teacher all year, that might even be changing, right? So some students might start in hybrid with a different teacher than the teacher that they have had. What does it look like to wear a mask in class? Right? When is it appropriate for them to take their mask off? Separation, right? Our students are not going to be able to be sitting within 6 feet of each other. I'm working in a kindergarten first grade classroom right now that is back in schools 4 days a week. And every single kindergartner and first grader has their own desk, right? That is different than they have ever experienced. So really introducing them to that. Lunchtime is different in most cases. Some districts, they are eating lunch in the classroom. Other districts, they are just doing bag lunch, and then students will be eating their lunch at home if they're doing an A-B schedule. So if some students are coming in the morning and then some students are coming in the afternoon. And then be honest with them in terms of cancellations of those after school activities. So many school districts are not going to be continuing those extracurricular activities because at this point it has been too difficult to figure out what that would look like in terms of with COVID restrictions. So let your child know that. When we are working with older students, that adolescent age, right, that upper elementary grade to middle and high school, this is where it's all about that open discussion, right? So what are they honestly concerned about? We know that high schoolers especially, and middle schoolers as well to a certain degree, they care more about their social status than they care about our opinion of them, right? They care more about what their friends think. So there might be some big concerns about that. Talk through their anxiety, right? It's absolutely normal to feel anxious. Think about ninth graders that have never stepped foot into their high school yet. What is that potentially going to look like if they are entering back into the building this year? And then helping your students prepare for those changes. So talking it out with them, having a friend or two over as well, or going through, a friend hangout on Zoom and talking about it with your child's friends. That's huge. And like I said earlier, and this probably isn't the last time you'll hear me say it, but having patience and abundant grace, right? For everyone, including yourself. I keep telling people that this is going to be the next tattoo I get because I've said it so many times this year. But if there's one thing I do hope that you walk away this presentation with, it's to take a breath, right? Acknowledge the things that you are doing really well right now because we know that you are. And accept that there are some things that might fall through the cracks right now, and that's also okay. A big thing for youth is to help them identify their role in safety. And I'll go over for younger kiddos what this looks like in terms of visual reminders and in terms of social stories. But I also have been working with a lot of high schoolers that have their anxiety has increased so much this year because of their fear of COVID, right? Because they're doom scrolling on news outlets and they have so much anxiety and fear about even stepping outside of their home, let alone going into a grocery store or going into a school building. So discuss how they can keep themselves safe and discuss how they can keep others safe. Right, and be honest and realistic with them. Pull up research that Dr. Ladish showed with us, right, in terms of what the CDC is saying about transmission. The more that we can be concrete with our youth, rather than talk in abstract, the more that they are going to feel safe in our information. A big one I know, especially for little kiddos, is alternatives to hugging, right? And we know that for some kids, the first day that they see you, they're going to want to give you a big hug because they are excited to see you in person, right, in the flesh. And so this is where we want to set up those expectations and be really clear, remind them what those expectations are for their own safety as well as for your safety. Naming it to tame it, right? So this is where we are acknowledging our youth's anxieties in order to help them understand what they can do about it. So we can help children identify their concerns really by asking them, what are they worried about? And then we name it. For little kiddos, for younger children, this is actually super fun because they actually like to name it, right? They like that when they are feeling, fear, they are going to call fear the worry monster, right? And believe me, if you're working with young kids, preschool, kindergarten, and first grade, one of the benefits of this also is they get to draw it out then, and they get to decorate. What does the worry monster look like? And what does it feel like inside when the worry monster comes out? For older youth, right, some high schoolers might want to decorate a worry monster. The high schoolers I have worked with, not so much. So in that regard, then just label that emotion, right? When they are feeling that fear, labeling it and saying that is anxiety, right? That is something that I can support you with. We can come up with coping skills together so that you are going to feel less and less of that anxiety. Really, the point of this activity and the point of engaging with this with our students, especially right now in that transition time, is that once we start to name the worry, it often helps build an understanding about that feeling, right? And if we can call it out, that's half the battle right there, right? It gives us more power and control. It also gives a common language that can be used when we are talking with our kiddos in the future, and when we want to provide that social and emotional support, right? Those coping strategies. Coping strategies are going to look different for a kid who's experiencing high anxiety compared to a kid that's having a hard time with emotional regulation, right? And so those are some areas that we want to work through with our youth so that we can figure out what is the actual emotion that they are feeling, and then give and support them through some coping strategies. And these are two examples, and I will tell you all of the visuals that you see today in my presentation will be up. Ashley will put them up on the Pierce County Kids Mental Health website. But there are so many examples online too. And so I definitely urge you to check them out. And literally what you can do is say coping skills for high schoolers, right? On the left side of your screen, you'll see those 20 ways to calm yourself down. And this is totally appropriate for a high school aged kid, right? Even middle school, where they're able to give themselves some ideas of what's going to help them calm down, right? Exercise might be a big one. I know that's a big one for me. And I know when I was a classroom teacher for my high school students that had really significant behavioral challenges, typically once, sometimes up to 3 times a day, I would take them down into the basketball court and play with them for a while, just to get out some of that energy. And also they like to make fun of me because I'm terrible at basketball. Sometimes taking a bath, right? What are some of those self-care strategies? For younger kiddos, this page on the right side, this graphic is a helpful one for students that's an A to Z of coping. And so this is super fun for either you to provide to them and then they can pick when they need to utilize a coping strategy, or you can give them a blank space of A to Z, right, alphabet, and have them start writing down, thinking of things for themselves that feels good, that helps them cope. This one, I can't say enough how important active listening is to our kiddos, right? Especially right now, especially how tied we all are to technology, to our cell phones, to our computers, right? Just to be with our kids and just sit with them and hear them and listening to them to learn, not to respond, which is different for adults, especially adults that have little kiddos. So when we do this, and this is effective, ECAP all the way through high school, validate how the youth is feeling, right? I hear what you are saying. That sounds like that would be really scary. That sounds like you're going through a really hard time. Empathize with them, right? And empathy is very different from sympathy. We know that we're in sympathy if we start sentences with, well, at least, right? Like, at least you didn't get an F, you only got a D, right? At least you only have to go back to school once a week, not 5 days a week, right? So being really clear that you're empathizing with them and avoid using terms like at least. And identify, right? Help your kiddos identify why they might be feeling worried. Just that alone will help them feel like you are understanding them and you are listening to them. promote problem solving. And what's really important about problem solving is we want to be preventative about it, right? We want to be proactive. We don't want to be reactive. Because as soon as we start problem solving when our kiddos are already struggling and already really having a lot of anxiety and having a hard time emotionally regulating, they are not going to be able to problem solve efficiently and effectively. So we want to get in front of that. If we know that hybrid is coming, then let's start preparing with our kids now, right? Let's start preparing with our older kids. Identify some solutions with them, right? And help them figure out what solution feels best. Maybe that is what Dr. Ladish was referencing in terms of let's walk to the school, let's play on the playground, let's see what it looks like, and then let's go home and have family dinner, right? Discuss different options, or if you're one of these people, I am a terrible role player, but you can role play these solutions with your kids as well, right? I'm not big into like make believe, so I have a hard time with role playing. But for our kids, we know, especially for young kids, role playing is huge, and practicing out scenarios so that they see, oh, right, this is what the consequence would be if I tried to follow this direction. But this is what the consequence would be if I use these problem solving skills. Focusing on positives. And we know we talk a lot about positives in the education system, right? About making sure that we are acknowledging our kids. And the same goes for at home. We want to start and end the day on a high note. So focus on the things that your kiddo might be looking forward to that day, right? Seeing friends, seeing their teachers in person, having a daily school routine. A lot of kids don't necessarily have the words for this, but we know, and what research shows, is that the more structure that we have in a school day, the better and more successful our youth are, right? And of course, what elementary kid doesn't love recess? Although I don't think I would love recess in the Northwest because it would rain too much, and I'm not a huge rain person, having to be outside. I know it's crazy that I live out here and I feel that way. So before school starts, asking, what are you looking forward to on your first day back at school, right? And then at the end of the day, at the end of every single day, what was the best thing that happened today? And that should begin now, right? That should begin right now. It's a really quick way to start focusing on positives for kids. And this is something that is helpful and beneficial from little kiddos all the way through, right? This is a ECAP through 12th grade strategy. What are some positives, right? That journal of gratitude. What are they grateful for? I said it earlier, but visuals are really important. Visuals really help with that scheduling, the consistency with our youth. And so you might need to use visuals. And Dr. Ladish did speak specifically about students who might be higher needs, maybe students who are on an IEP, who have some more significant mental health challenges. All students can benefit from visuals. It's really just good teaching practice. And we know that when visuals are used with students who have additional challenges, students in special education, there's a lot of power behind that too. So for example, to prepare our kids to get up in the morning, right, when it's time, which is a little bit different than when they're only doing remote learning, have that visual of what time they have to get up, right? Prepare them, get into that mental mindset. What are they excited for, right? Put a picture of that playground up for them so they know that when they get home from school, right, at 12 o'clock or at 3 o'clock, right, you may have a neighborhood playground that you can take the family to, that you can take your kiddo to, or the playground at the school building. What type of homework do they have, right? Start making sure that they are staying organized. So what does homework look like? And then making sure that there are things at home to be excited for too, right? Maybe it's a Friday night pizza and a movie night, but get them excited for that. And I'm going to show you some examples of reinforcement systems that you can use for kiddos so that they have these visuals alongside with what the reinforcement is. What are they going to get, right? Because we know that intrinsic motivation is much harder right now. So some other visuals, and these you see on the left, it says wearing a mask, and then on the right, it says what is social distancing. These are amazing social stories. It's through a website called Autism Little Learners. And although social stories have been shown to be super successful with working with youth with autism, we know that a lot of those, like I said earlier, a lot of practices for youth in special education are just best teaching practices anyways. So if you are working with young students, if you're working with students who need this visual, I will have on the resource list that Ashley will put up onto the website, specific social stories that you can print out for your home. And 2 of them being wearing a mask and what is social distancing. YouTube has some great videos about this as well. If your kids are more visual learners in terms of a short video clip, utilize YouTube and just Google, right, wearing a mask for preschool. And they're going to show you, and they're going to show examples of a little, little preschool kiddos putting on their masks as well. So you can show your class. Also having a to-do list, right? So this goes into those upper grades, middle school to high school. What are some of those things that they need to do to be prepared for hybrid learning, right? For transitioning back into the classroom. What does that look like for them? And then, like I said, right, that intrinsic motivator isn't necessarily as strong right now. We are all struggling with it, myself included. So having some extrinsic motivation is really key right now. Getting our students excited to do stuff, getting our kids excited to do stuff, and knowing that there's a reinforcement that might come with it. For some youth, that reinforcement is as exciting as a teeny tiny little smiley face sticker, and that's all you need. Right. And believe me, I never thought stickers would work for high schoolers until I started giving it to them. And then they would get angry with me when I didn't put one on their paper. So stickers are huge, right? And they're not expensive. They're easy to gain access to. And you can make this list as big or as little as you want, right? Depending on where your kiddo is at. Some type of reward chart, for example. And so just putting that task down, what do they need to do? And then what do they earn, right? And sometimes it's you need to, complete 5 of the tasks and then you get a bigger reinforcement. And I'm sure you can hear my language. I tend to use the term reinforcement more than reward. And I'm a big believer in reinforcements because that is a big thing that does lead to intrinsic motivation. And these are all, again, I will make sure that these are up on the website, but this is another example of looking at on Google, finding access to these. There, Pinterest boards aplenty of reinforcement systems for young kids all the way up through high schoolers. For youth that are nonverbal or for younger youth, I would definitely in a reinforcement chart like this, put a picture of what it is. So if it's brushing your teeth, I would physically take a picture of the kid brushing their teeth and put that next to it on the chart so that the kid knows what that is, what that expectation is. And lastly, before we open up to questions, just to reiterate about being a role model and how important that is. And that means setting limit for screen times. I have to do that in my personal home, right? Because I could easily be online for many hours a day into the evening if I didn't set a limit for myself, right? Having family dinners, an easy way to debrief the day, right? How was your day? What was something that we could have done differently today? This could also move into family circles if that's something that you would consider in your home. That might sound a little like woo-woo out there, but I promise you family circles are so impactful for just building that community and establishing that for your family, right? What are some acknowledgements that you could have for each other? What are some positives, and then what are some things that you would want to work on? Positive affirmations, not just giving those to your kiddos, but giving those to other adults in the home too, right? Making sure that our kids see us affirming other people, other adults. Being vulnerable, right? That means that, expressing yourself through vulnerability as well as through strengths. Being that active listener, like I spoke about. and communicating. If there's something that you're seeing, if there's something that you have questions about, reach out to the school, right? Reach out to the administration, ask them those questions, the school board as well. And then that consistency and predictability. So research does show that the more consistent and predictable an environment is, the less anxiety for an individual. So this includes daily bedtime and wake up time, routines, and expectations for school and home. I've been supporting one family recently who has had really strong routines in their home, has had a daily bedtime, and their kiddo is still not waking up. They are not waking up, and they keep pushing the bedtime earlier and earlier, not waking up. I got an opportunity to observe into that home, into the environment of the home, and the kiddo had their iPad in their bed every single night, right? Actually, to the degree that by the morning, the iPad was dead and they would have to charge it before class started. Right, so that was such a little thing that the parents didn't catch, but in the overall grand scheme of the routine, that had a huge impact on the kid. As soon as that iPad went into the parents' bedroom every single night, right, then this didn't become an issue anymore. The kid was waking up in the morning. All right, thank you so much. That is the end of my presentation. And I know I see a handful of questions in the Q&A box. So I think, Ashley, should I stop my presentation? Oh, there you are.
Yeah.
Perfect.
All right, and I will invite Dr. Ladish to come back on the screen. Thank you so much, Tovah. I know that was for students and caregivers and educators, but I feel like I took some things away. You know, I think it's so important for us to end the day really focusing on what went well and, you know, what things happened today that were good. So thank you for those reminders, and those were some really, really great recommendations. And so I will go through the questions and answer box, and we will get through these as many as we can. Like I said, if we can't get to all the questions, we'll definitely follow up with you after today's webinar. So this was a question from one of our participants that says, why would asynchronous work be better than to continue virtual and hybrid? My daughter seems to struggle in asynchronous. She needs the structure that even virtual provides.
Is that in reference to a school that is choosing to only do asynchronous? Let me try to pull it up and see if I can.
I'm not sure.
Asynchronous work be better?
And maybe this is a question that we could connect directly with
yeah. So Stephanie, yeah,
specific.
and I think what I'm thinking is in terms of your kiddo is going to be going into school a couple days a week and then having asynchronous completely separate from virtual.
And the panelists can't respond back in this. So this might be one that we can connect via email and answer that question.
Yeah, definitely. You know, every kid learns so differently right now. That has been one of the biggest challenges with virtual learning. And I know that school districts are trying to also accommodate for classroom teachers as well. So what does that look like for classroom teachers to be doing hybrid, which includes, right, like having a separate virtual classroom and having students in person?
Thank you. And we'll connect via email on that if there's any more specific questions. So I know you touched a little bit on this, Tovah, but between you and Dr. Ladish, what would you recommend for those who are struggling with a diagnosis like ADHD or intellectual disability, specifically autism spectrum disorder? Do you have any tips for them, especially children or youth that may have some sensory concerns?
I have lots of general ideas, and one thing I can do, Ashley, is get a copy to you that you can post on the Kids Mental Health website. I have a few patients that I've worked with that have just, you know, kids on the spectrum and kids with intellectual disabilities have a lot of challenge with transition and change. And so I created a visual model for some of my patients. It's just a change wheel that basically works you through the stages of change, that something's new, change is coming, I'm getting anxious, I'm in change, I'm, feeling a little better, but still unsure. I'm starting to learn about change, and now I've got mastery, and what was new is becoming the old. And you just kind of keep endlessly working through this cycle. But as a visual aid, it can be very helpful for kids to understand. I think more concretely, I would say, basing things in context. A few high level things I would think about: once we learn and people have dates for returning to school, your kids best. If your kid is the kind of child that's going to be anxious with that anticipatory anxiety, don't start too soon. We don't want to tell kids a month in advance that they're going to be going back to school if every day it's going to be, when am I going, when am I going? Some kids do better if they only have, 3 or 4 days to kind of see that it's happening. Other kids, they need that information sooner rather than later. And then I think anything we can do to make it familiar and to help them feel masterful about the change. So that's where I come back to practicing without pressure, things like social stories, getting over to the school grounds, even things like practicing, putting our mask on and accompanying mom or dad to the grocery store, things along those lines, so that kids are kind of getting in those habits and then those routines.
Thank you. Tova, did you want to add anything to that?
No, I think that was great.
Perfect. Another question I see is from Taylor, who is a high school teacher who's been teaching high school classroom lessons regarding grief and loss specific to things, experiences, etc. Do you think there's value in trying to transition these lessons now to more of a cognitive-based type lessons addressing anxious thoughts? There's good engagement as they haven't really had space to mourn, but wondering if there's time to shift knowing in person has them worried.
Yeah, I can start, and then Chris, if you want to add anything. But hey, Taylor, I think asking the youth if that would be beneficial for them. I know CBT is incredible especially for grief and loss, and I think it would be a super helpful transition. And see if that's what they want to start, like, slowly transitioning to work on, or slowly processing to work on. But I think it would be appropriate, given the speed of hybrid learning right now, like the speed of how school districts are moving towards it, that for students experiencing grief and loss, it would be beneficial to start talking about the changes coming up through CBT.
And I was going to say, I think that you can I wouldn't think of it as discretely ending one and starting the other. I think that thread, you can just move right on into some adaptive cognitive strategies. I think that sense of grief and loss is going to remain with all of us for quite some time, even though we'll be back at work, back at school, all the things that are happening, it still will not feel the same. And so I think there's going to be elements of grief and loss throughout the year or years to come. And to get through that is where the cognitive behavioral strategies come, right? So then it's okay. We want to acknowledge what we're losing and how it's different. And then we want to teach coping strategies to be able to manage the stress inherent in that.
Thank you so much. Just 2 more questions. And one is just a clarifying question, Tova, that came up during your presentation for a recommendation. And the participant was just asking for clarity if it's not a good display of empathy to use the term "at least," and if you can expand on that a little bit.
Yeah, definitely. Thanks, Jamika. That is correct. We want to avoid using terms such as "at least" when we are working with anybody, with adults or adolescents or kiddos, when they are feeling all the feelings, right? When they are having emotion, when they are having fear, having anxiety, because "at least" often dismisses what they are saying, right? "At least" kind of puts it on us. Like, if I'm telling you, well, at least you didn't go through this, then I'm kind of putting it back on me, like it's an issue that I had. And so we want to avoid using that language. And I didn't have time to play it today, but Brene Brown has an amazing video explaining this. And it's like a 2.5-minute video. So if you just look her up on YouTube, Brene Brown, I can put it into the chat. She has a really wonderful definition and explanation of avoiding that term.
The power of language.
Yeah.
And this will be our final question. Any specific suggestions for families that have moved during the pandemic? My child will be in a new school, which is always stressful, even more so now. This may also apply to families at risk of losing housing with the end of the eviction moratorium.
I think one place I would start with that is to come back to what your child has already endured and how many new starts there have been throughout this pandemic. And I would build in a lot of confidence around, we had this change and this change and this change and this change, and look how well you are doing, so that the child can see that this isn't sort of the one new thing, but this is a series of new things that I continue to do and build strength on and build capabilities with. I think that can sort of not only make us feel like, oh, here's the next thing coming, but how do I look for the next thing that I'm going to get through successfully? So that would be just one simple strategy that I might suggest. I don't know, Tovah, if you have other ideas about that.
I think the only thing I would add is if right now there's any access to like a way for your kiddo to meet other kids that they will be attending school, right? And that totally could be virtually, even seeing if the classroom teacher could set that up. And doing the walkthrough that Dr. Ladish had spoken about, right? Getting your kid comfortable with the school, even just like, where is it? Or what route will I take? Or where is the bus going to pick you up? Kind of starting to get into that routine and that predictability so that there's less anxiety of wondering what the heck is it going to look like that first day back.
Thank you. Thank you so much for both of your expertise in your materials and your resources. It's just amazing to hear some of the strategies that you provided and some of the feedback that's in the chat box. And I just want to remind everybody that participated today that this is a resource for you. If you have any ideas, if you want to be a panelist, parents, we want to hear from you too, to share your expertise and suggestions you may have for other parents. This is definitely the forum for that. And so again, I just want to thank everyone for being here today. We will be posting this recording as well as all the materials on our website, which is kidsmentalhealthpiercecounty.org. I do want to share that our next webinar is going to be on Wednesday, February 24th, and it will be on youth suicide prevention with some of our community partners from Coordinated Care. I did put a link in the chat for registration. This will be a limited registration to the first 100 participants. So that will allow us to have some good small group discussions and really be able to absorb the materials. So again, thank you all for joining us here today. Thank you for your questions and your lovely engagement. Thank you, Tovah. Thank you, Dr. Ladish. And as always, please check out kidsmentalhealthpiercecounty.org. And we look forward to partnering with you and collaborating in the future. Thank you.